Okay, thank you very much. I'm very pleased to introduce our next speaker, Dr. Anwarul Haq Jabarkhel, who is the president of the NGO Ibn Sina. And Ibn Sina is an NGO that since we started in Afghanistan last year, we have worked very closely with in Ahmad Shah Baba, because Ibn Sina was the NGO that was supporting this hospital before we started to give our support in Ahmad Shah Baba. But also for Helmand province, because as I said earlier, Ibn Sina was the NGO that was providing the support to most of the health centers in Helmand province, and their assistance and advice on how to work in a difficult area like Helmand has also been extremely important for MSF. But besides being the president of Ibn Sina, Dr. Anwar is also a scholar, especially in the field of Islam and health. And in that capacity, I've invited him today to give his vision on how health and healthcare relates to Islam, and hopefully also to be able to be challenged by everybody here on his vision. So, Dr. Anwar, please.
Bismillahirrahmanirrahim. In the name of Allah, the most gracious and most merciful. Alhamdulillahi Rabbil Alameen. All praise be to Allah, the cherisher and sustainer of the world. Assalamu alaikum wa rahmatullahi wa barakatuh to everyone. First of all, I would like to thank MSF for inviting me to this conference to share my concept of health in general to everyone, that we all try to improve health. And also I'm very thankful to MSF that in the very beginning we had some discussion and we encouraged, for good reason, MSF to support Ahmad Shah Baba Hospital. Anyway, my presentation will be very short. I will not take more than half an hour to explain my concept of health and how Islam is going to improve health. And then I would like more very good discussions. I will then make the floor open for any question. I'm not saying what question. Any question on the earth. Free, everybody needs to feel very free, Muslim, non-Muslim, to ask me anything, and we would be very, very happy to hear any question, and we discuss it. I will try to answer any question. It might satisfy your, question or may not, but please, I would request that you can ask me any question on the earth. First of all, as health professional, I think most of you might understand that there are a number of concepts of health which throughout the history of human being has come, but to be very brief, the last few of the concepts I would like to mention to you, and then my concept. Well, it's very important to understand the concept of the health in order to give health care. And we all know that most of the people around the world, and even the health professionals and scientists and other people, do not understand health the same as it is. So this leads to always confusions, questions, answers, and it also gave rise to new concepts. That's why I'm also coming with a new concept today to the world. The first concept, very recently, we call it biomedical concept, which many people understood that absence of disease means health, which I don't need to go to debates that it's inadequate today, we all understand. The second concept, people came, scientists, with ecology concept, which again, that does not satisfy, all the debates that we do. Then it's a psychosocial, concept in health. Then it's a holistic concept. Then finally, let's go to WHO definition of health. In 1948, in the preamble of their constitution, they made a constitution, the definition, which obviously World Health Organization is comprised of people around, the experts from the world. I'm sure everybody knows the definition, especially the health profession, that how World Health Organization defines health. There is written, health is a state of completely well-being physically, socially, mentally, and it's not merely the absence of disease or infirmity. Now, spiritual health has also been added. It's also been added that everybody needs to have a productive life socially and economically. Okay. Now, how it might be interesting to you that how I came with a new concept, or the concept that I'm explaining to you, as I graduated from medical school in India in 1984, was very interested in Islam, but like any Muslim, did not understand what Islam is actually. So I joined jihad. I went to Pakistan 20 years ago, and I was a very young Afghan refugee that God gave me the best chance, that I start working with IMC, which is called International Medical Corps. It's an international American NGO. And when I joined that organization, in 2 months' time, I was offered the job of becoming medical director, deputy medical director. And then in 1 year, I was the medical director of that organization, very active organization, and it originated from Afghanistan, actually. So at the time, I had, 20 years ago, 30, 40 American and different international staff working for that organization, and I was leading. And I was very quickly became the country director of that organization for Pakistan and Afghanistan. And IMC did a great job as far as Afghanistan and Pakistan are concerned. And still, I think IMC is very proud of what they have done in Afghanistan. And I've been with them for 18 years. But having all that good work, I was troubled as a Muslim that I've come for jihad, I love Islam, but I have no idea what Islam is actually. There's so many questions I cannot answer to myself. And when I was discussing with religious leaders, I was not getting the right answer that would satisfy me. So finally, 12 or 13 years ago, I decided that let me read Quran myself and see what I can understand. And then it took me 3 years, but I studied day and night. I remember I was not a very good regular student in medicine, but I used to get good marks to pass, but not studying too much. But I studied Quran day and night for 3 years with myself, every verses, and then I was trying to analyze that what every verse is actually teaching us. It took me 3 years. My family, my wife and my mother, they got very worried about me that I'm going so deep. Sometimes they have an experience of someone going very deep, they can become mental. But I was always giving a smile that no, I think I'm going to get a real knowledge of what life is and how we can lead a very, very healthy life. Which after 3 years, I realized that first time in my life, I realized that now I understand what health is, what life is, and how I can be the best, healthiest person on the earth. And that Quran taught me. The medicine I read in the medical college, I also went to Harvard for some management programs. I never got it. So I realized that I got the health concept from Quran and the concept of life. Anyway, now what the concept is. My understanding is, so I asked a few questions to myself, major question, that why I'm born in this world. Who brought me here? What is the purpose of me coming to this world? And how I can, lead the best possible healthy life here, and how I can be the best possible healthy person, after I die, forever. So simple questions I was asking myself. So I said, okay, obviously there is a power that we say Allah. Allah created us. Now I ask Allah that why did you create me? I want answer from my Allah to tell me why He created me. So He has to send me a book that, tell me why I've brought you and how you can keep yourself healthy and how you can, be away from harm and always in benefit. And for that, obviously, a teacher is needed that He sent the last prophet to explain the book and practically exhibit what it means to be healthy and have a life and have a hope for forever. Okay, then, for the last 20 years, that now, as I said, I've been one of the person to play a very lead role in the whole system, policies, whatever, in Afghanistan. Because I never left Afghanistan for one day for the last 20 years. But still I was knowing that I do not understand health. And now I think I understand it a little bit. So to me, I ask myself, if I look at this, can you go back to the definition of WHO? So I was thinking, if health is, I fully agree with this sort of definition that WHO has given. If health is my physical part, my mental part, my social part, what else do I have? Even we said spiritual part. So what human being else has? Anything else? I didn't find anything else. So to be brief, to me, health is everything in your life. Anything you do is actually health, related directly, not indirectly. Why do we wear clothes? Why do we make house? Why do you have AC? Why you're making the chair? We need to ask ourselves question. Why do you need a road? For what reason? If you don't have a good road, you're going to be bumping, your physical part will be harmful, and also mentally you would get tension. Harmful to health. The world is going through hell because of drinking alcohol. Columbia University in 2005 in the United States made a survey. 39% of vehicle accident in the United States is because of drinking alcohol-related driving, which comes to 18,000 people dying because you just drink alcohol, you don't know, you drive, you kill people. 18,000. The cost, according to that survey, is $220 million for them. The physical part, how many cancers, every part of your body can get cancer, this, that, another thing. More important, what alcohol does is actually breaking families. And even the survey shows the effect of alcoholism is so serious that even the person who dies, the negative effect of its actions on the children which grow up are enormous. So even if you die, you have already harmed your children's health. So that's why I understand, alcohol is bad for health, that's why Allah is telling me don't drink. Allah says don't smoke. No intoxication. I don't think to explain what smoking is doing to the world. Adultery. Now, if you all know the statistics of the world, the WHO, UNICEF is presenting that 80 million unwanted pregnancy happens every year in the world. 80 million, out of which 50 million lives are aborted. 50 million. My question is, are we progressing as human beings? 50 million, because there is a debate of, pro-life, pro-choice. But I'm pro-life, definitely. 50 million people, life, or we are killing them, and we think that we human beings we are developing. I don't understand it. I'm not convinced. 50 million. Because what happens? Adultery leads to pregnancy. And when the pregnancy comes, you have no choice but to kill that. You're not ready for it, or whatever reasons. It can create a lot of social problems, it can mental problems, whatever problems. So these are some of the examples that I gave why Islam has prohibited this or that. It is all that you should not be in loss. Anything Islam has said, it is in your favor. So what Islam, another word I would say, is for loss and gain. In loss and gain, anything which you lose, your health will be hampered. Anything you gain, your health will be better. Now, the problem around the world, it's not Afghanistan. To me, we human beings have really not understood the concept of health. That, to me, health is everything, and we will do debate. Find me one single thing in your life which is not directly related to health. Now we need to educate human beings around the world, whether it's in America, whether it's in Europe, whether it's in Afghanistan, whether it's in India, that first we have to create the real awareness of health. And then, okay, we have to come up with a package that how we can improve that. And my answer, the ultimate solution is, I said Islam, which we can debate. Now it's like Germans make a beautiful Mercedes-Benz car. They give a direction that you have to have your belt this, you change the oil, this, that, and drive it right, traffic laws and everything. If you really follow those laws and instruction of the company, I think the Mercedes-Benz, if the road is good, can run for 30 years. But if you do not, you can just make it a small piece of metal in half an hour. Similarly, when God has created us, God needs to send us the direction as how I've created you and for what purpose and how you can be the healthiest person for whatever period you live and what will happen to you when you die. It's nothing any human being can do. Anyway, I think, as I said, that's my, new concept. By this, what I'm trying to do, and few achievements. Obviously, when I started a number of years ago about Islam and health, people were surprised that someone who's a doctor, who's leading an American organization, he's talking about Islam. I don't know, what is this? But any individual, if you want to make a change, you need to go on and believe in it and go on and make people aware and change your own policies according to your vision. Now, what happened? I was able, for the first time in the history of this country, to arrange a conference of 1,000 people, less or more, of religious leaders in Afghanistan. In Eastern region for all 4 provinces, North 5 provinces, Herat, My simple suggestion was that we have not understood Islam. If we would have understood Islam, we would have been the healthiest society on the earth, and we could teach other people how to be healthy. So obviously in the beginning I had serious problem, with chai, all the religious leaders sitting, listening to a doctor saying so. But then I challenged them. I said, let's ask questions. So, thanks to Allah, that in all the provinces of Afghanistan, all the religious leaders, they have no problem with the concept now. They have agreed to that's the right approach to understand Islam. Now that's awareness of the religious leader, the doctors, the government, the community. Now what happened because of this concept? So the Ministry of Health, I think maybe as far as I'm aware, no Ministry of Health in Muslim country has a department by name of Health in Islam. Now our ministry has a department by name of Health in Islam. If you're not aware, there is a department, and Ibn Sina is supporting that. But I'm not satisfied, not a department. I think the Ministry of Health of Afghanistan needs to have the deputy minister who understands Islam and health. He may be a doctor, he may be a religious leader. I have no problem. But he has to understand what health is and how Islam improves it, which I'm sure is coming. Which for the first time, a week ago, I think, or 10 days, if my Afghan colleagues might have heard on TV that the Ministry of Health arranged a national conference on health in Islam, and there were a lot of good discussion, religious leader and doctors. So to me, the religious leader and the doctors are the same, because I say health in Islam is the same. So the people who are working for health and people who are working for Islam, they're together. In Ministry of Education, I'm glad to inform you that the Ministry of Education, based on my ideology and vision and this concept, they agreed to make one full subject of health in Islam included in their curriculum, which I have to write books and things like that, and then that will be published. Now, recently, the Ministry of Education announced a new Deputy Minister, Islamic, and the Education Center. Third, one of the religious leaders who is teaching, and one of the madrasa in Kabul, he was going to Sudan for doing a master's degree in international law. I talked to him, I tried to make him understand my concept, and I told him, talk to the universities there. So he finished his international law master's degree, and while debating this with Al-Azhari Azim University, after debates, they accepted to start master's degree in health in Islam. First time in the history of the world, the master's degree has started, and he's the first one who became the student of health in Islam. So he will probably the most right person after 5 years to be the Minister of Health. He's not a doctor, he's a religious leader. But he did master in international law, he did this. And through this concept, what I try to do is to make people think what health is, how much they understand about health. As I said, because it's very important. If you don't, whatever policies, strategies, everything you make is based on the understanding of the concept first. If you don't understand the concept, or whatever understanding you have based on that, you make this. So to me, I'm telling my country, my Ministry of Health, that you cannot improve health. You will never improve health unless you, the minister, and your deputy ministers, and your directors understand what health is and how, and also understand Islam. The whole world might come here, be for 100 years, will not improve health. Relatively, maybe there's something. But my vision is we have to work so much that the education system works like this, that without spending money, we need to be very healthy people. We don't need to spend a lot of money to be healthy. It's the understanding which makes you a lot better, healthy person. What simple thing? Don't smoke, don't drink, pray 5 times, clean yourself all the time, have oral good hygiene, Peace be upon our Prophet Muhammad sallallahu alaihi wasallam. There is no single example of a human being like he was taking care of his oral hygiene. He was using maswak, which I will distribute the books, that I've written a book on oral hygiene and maswak. He up to 20 times was taking care of oral hygiene a day. We doctors should ask ourselves, how many times do we clean our teeth and mouth? Is there any human being born in this world or will be born to be so perfect to take care of your oral hygiene 20 times? And we all know, the doctors know, I think, that what it means to have very good oral hygiene, how it prevents and promotes your health. So, in short, I tell to all doctors, all health professionals, that if you understand Islam, that will be the only time you will improve health. For example, now I did a lobby to all the ministers and even to the president that how come we make a hospital, we make a school, we make a hotel. The Ministry of Foreign Affairs of Afghanistan. If I go, first time I would ask, do you have a mosque for women and men? And a good washing facility for that is needed. Because mosque is, without a washing facility, it means nothing, because you have to wash. And also for men and women, not for men only. I'm so surprised, for centuries, Mujahideen came, Taliban came, this government is coming. This question doesn't come to them. Serena Hotel, this hotel. We have a conference. There are women, there are men. Now at lunch, they need to go and wash. They need to go and relax and pray. Why? You've made a big, this hotel, but you don't have a facility for better health practices. So I'm asking the government to make a law that no building of this kind, the design should be passed unless there is a mosque for women and men, because it's for health, improve health. So I'm sure, inshallah, they will listen, and in a year time, no building will be built in Afghanistan without a healthy practice, which is mosque, with good washing facility. Islam is for everyone, not for me, not for you, what I say, for everyone. So I'm sure there must be very good questions, a lot of questions. I'm just opening the floor for debate.
Family planning, because when the God creates someone, it will be created. Then what is the need of family planning? Because this family planning is a big issue in the field sometimes here, which is raising from the community side. They say that's not correct. What do you think about it?
In Islam, first of all, you have to understand, everything is planning. You cannot do anything without planning. Nothing. Even when God created the whole universe, He says, I created in 6 days. I don't know what 6 days in time means. He didn't say, I just created in a second. So Allah planned to create a universe. Right? Now, in your life, the biggest flexibility, the biggest options on the earth, any system gives is Islam. It gives you all the options based on your situation. The first thing Islam says, that on every woman and man, education is must. It's must, farz. If you all know, farz means must. You cannot get away from it. So it is must on every father and mother to be educated, and it is must on them to educate their children, woman, the girl and boy. So this is the first rule, 100% rule. Now, God says, also I've given you brain, think and analyze your situation. That he has made this must, but he's not said that you have to bring 10 children, it's must. It says bring the child and train or give them the right education. So you have to analyze the situation in what time of the world you are, what it means to educate your children, how much it costs, where you will send them, all that you need to analyze all that. That is what the teaching is. But also, now I'll specifically come to the medical part. Prophet, peace be upon him, someone asked about this question. He said, do azl. Azl means withdraw or, discharge. You understand? It means that is, and then see how Allah has given natural family planning. When breastfeeding is there, unless you have not amenorrhea, 100% you are, prevented. Right? So there is 100% allowance for the planning. But the planning means in a different area, different situation. For example, if you're in a very remote area, there are problems. At that time, you might need more children for your protection, for your security. So you plan that. But today in Kabul, you cannot have 10 children and earn 3,000 rupees per month. Because then Allah says, under no circumstances, I accept corruption. Corruption is the biggest cancer of human being. So, if you bring 10 children and you have 3,000, what will you do? You will be corrupt. And if you're corrupt, clearly Allah says you are in hell, here and there. So yes, I've written some very strategy for family planning based Islam. So yes, in Islam I say everything is planning. Without planning you cannot do anything. And you have to do situation analysis. Thank you.
Thank you for the presentation, Doctor. Please can you tell me if the Islam suggests any duties from the part of doctor towards the patient? And more specifically, if a very poor man goes to a doctor and says, here is my child, treat it, I have no money to pay. Islam suggests to the doctor what to do?
Yes, 100%. Islam, if he understands a little bit of Islam, he will do it free. Because it is in his benefit. I will explain how the doctor is going to be benefited by giving a free treatment without cost. The doctor first would get the benefit rather the poor man. How? I'll explain to you. You see, what actually makes our health, there is, as I said, mental, physical. A poor person comes. I'm a doctor. I have earning, I can eat, I have a house, I'm doing my life. So you come as a poor person to me and I treat you. The first thing Islam says, you have to salute him first. Very, very warm. Irrespective of he is poor or he is a president or he is anybody, no. Your duty is to, the first communication you start, Assalamu alaikum wa rahmatullahi wa barakatuh. Right? This is the first teaching. Now you greeted him, you received him so warmly. That is the number one teaching of Islam. That's why I say every standard of our checklist should be based on Islamic thing. Now, I treat him and he says, I don't have money. I say, great, no problem. Thank you very much for coming to me and trusting me to treat you. Now what the benefit goes to the doctor? The doctor inside feels very happy, very satisfied that he did a right thing. So when you think that you're doing a right thing, your physiology and biochemistry always are on the positive side. You know, it gives you a happiness, a mental satisfaction. And then you see him greeting you, loving you. We all need love and respect, right? And then this doctor, when walking on the street, this man who's been treated like this will give him so much love and respect that he cannot buy it with 50 Afghani. So yes, the doctor has to, not this or that, has to do it free of cost. But provided the man is telling the truth and not making manipulation. Thank you.
I don't have any question, just I had a suggestion, wanted to share it with you. Yeah, I mean, we are Muslim, I mean, not everybody, I mean, Afghans that they are here. We all are Muslim and we have nothing against what you have just presented, and personally I fully agree with that. But the objective of your presentation that you mentioned at the beginning was to teach or to show what's health and what's somehow an healthy practice, and to put some light on it using, some proof from Islamic with references, mainly Holy Quran, to put some light on it, and that people should accept it, and that should have healthy practice. Just one point came into my mind, that there are many religions all around the world, and many in the major religions all around the world, there are many teachings that they are proved that to be healthy, and they can, even respecting those teachings, you can have an healthy life. In order to, again, it's a suggestion for you, that the number of the audience should increase, and also that using this important topic of health as a link between the people, the follower of different religions all around the world, that to bring them a bit closer in order to contribute in the global peace also at the same time. Why not to quote also some earthy teachings that there are many in major religions, including Christianity, Jewish, and also even in Hinduism and many others, that there are even some of these teachings are common in Islam and those religions. And to mention then that in a way we can bring the people also close to each other through this link of health, this topic of health, and somehow contribute to this global peace. Then in this case, even we can change suggestion, whole suggestion. As the topic, the title of this as a kind of religious practice with a relation with health. Then you can use the other sources like, as I said, like Bible, I don't know, Old Testament, New Testament, some Hindu scriptures, and then it can bring also at the same time this health topic can bring the people, the follower of different religions together, and somehow will be certainly help in global peace at the same time.
But let me tell you, Dr. Waid, if you don't mind, my message is very clear first to Muslim, to doctors. I say you will never improve health. That's what we have not done. We have failed to improve the health of our country. What I said, I hope you understood. To me, health is everything. Why we failed to improve health of our own country is Muslims. And today, the whole world has come to help us. It's a very shame thing. It's a very shameful, time for us, for the whole Muslim community, that how we have failed to improve our health. So to me, the first message, going beyond Muslim, the first message is to you and to every doctor that you studied 7 years of your medical college. How many days did you spend to understand Quran? That is what our problem is. Unless we go to our Quran, the whole world might be here for 100 years. We will not be healthy people. That's why I say the free, giving free anything makes us much more, cheaper human being than anybody can think. Because the Prophet, peace be upon him, says, the hand which gives is upper and receiving is better than the other one. So my message first is to the Muslim Ummah, whether it's Afghanistan, whether it's any country, that you're in trouble because you have not understood your religion, which is so complete. Then it is the duty of every Muslim to explain what Islam is. And it's also the duty of every human being to ask, because now I ask questions to my Muslim people, that why you're a Muslim. I get the answer that because my father and my mother were Muslim. I ask Hindu, why you're a Hindu? He gives me the same answer. I ask a Christian, he gives me the same answer. I mean, to me, it means nobody has thought why he is accepting something that his father or mother was practicing. So you have to ask yourself, as a human being, if you want to develop, that was my father right or wrong? And why right, wrong? So, now all the religious, the purpose of religious, that God has sent prophets is to make people aware and understand as how to live in a healthy life. But there is no doubt about that I have to give this message, and that's why the debate goes on, that all the religions, all the prophets were for a particular section of human being at that time and for a particular time. That's why the challenge is, without bad feeling, we need to sit on the table without having any grudges against each other. I say Islam is the only complete package. Yes, there is Christianity, which is also, we believe that was the book of God, but for a particular time, and it will not give complete answers. It will give you answers for number of questions, but it's not going to give complete answers. My challenge is that 6,666 verses of Quran is to improve health. Now it's a good discussion. Everybody needs health. If I'm a Muslim, if I'm a Christian or Hindu, anybody who is there needs help. So we have to first make people aware to understand the holistic understanding of health. Because I told you this is a concept. The holistic concept I explained, but I'm 100% holistic approach is that I say everything is health. Anything. Why do you keep beard? If I have asked you that why our Prophet, peace be upon him, kept beard, what would you answer me? I say to improve health. I have answer for it. So this is something that for us, I said it to Afghanistan, to the president, to the whole country, do not be happy that the word is coming in, which is good, fine.
Sorry for stopping you, because I think I have to express
sure.
myself, because probably,
please.
Probably you got me wrong. I mean, I have nothing against this.
No.
But what I meant, what I wanted to say, was this, that keeping this Islamic teaching, which is, and at the same time trying to find something common, similar in other major religions, that there are many commonalities between Islam and other major religions. So beside this teaching of Islam, you can mention this, that the people, the follower of other religions, also will see this commonality between Islam and their religion, and then it can somehow help this that
I understand. No, thank you very much. But in between what I said, the question is, first of all, I said, I'm creating the answers first to my people. I say the problem first, I don't talk about non-Muslim. I say our problem, Muslims, as I said, all the doctors who are sitting here, I would ask them that you studied 7 years of medicine. How much time did you give to Quran to understand? So to me, you do not understand health because you never understood Quran. And how can you answer to yourself, to Allah, to this country, right? For example, I see this is an Islamic country of Afghanistan, Islamic Republic of Afghanistan. I have the right to ask the minister of Afghanistan that how much do you understand about Islam? Do you pray 5 times? Do you understand how to pray? You understand what I'm saying? So I'm creating, yeah, sure. No, we are coming, we have time. It's a very good discussion.
No, we don't have so much time. Maybe you can have more questions.
Okay. So I will just finish it. I say no problem. This is what I say, Islam is a complete package. If you have, from Christianity to contribute to health, great. If Hinduism has, great. But my challenge is not complete. That's what I say.
Thank you so much from the speech. I just wanted to ask you, because we have heard that we would like to have a Department of Islam and Health in the Ministry of Health. It's interesting for me that what I want to know about, is there any list of objectives that we would like to get or to achieve through having this department in the ministry, or just to know?
Thank you very much. Yeah, I mean, first we have to convince the ministry to have this department, yes, for good reasons. The thing is my full suggestion is, any strategy you make, you have to consult your Quran. What is Islamic strategy to improve health? Then go on, like what this minister asked me, that, how to ethically approach a patient. I said the first communication, you have to greet him very warmly, something like that. So this department, the whole thing, the major thing is first of health or another ministry, so it will come. It will slowly, everything will be in writing, things like that. Thank you. Yes, please.
I'm Vicky Hawkins from MSF's office in London. So just to say quickly, I've worked in Afghanistan for a few times, the last time in 2004. It's obviously my first time back, so it's really great to be back, and I'm very happy to see MSF working here again. Thank you very much for your very interesting presentation. I had a question about MSF UK, the office that I am part of, has actually done a little bit of work around trying to understand some concepts within Islam better, and particularly we've looked at humanitarian action within Islam. We're trying to understand commonalities between what we conceive of as humanitarian action and Islamic concepts of charity. So it's a little bit related to what you've been talking about. But I had a question which was about how appropriate it is for international staff to be talking about the kind of concepts that you have raised, because we have tried to introduce some ways of explaining what MSF does better within a kind of Islamic framework. And one of the issue that Statis raised about the duty of a doctor, rather than talking about the rights of a patient, was something that we discussed in our paper. But certainly we have our own concerns, and there were concerns raised within MSF as well about that it's really not appropriate for international staff, international medics perhaps particularly, to be talking about Islamic concepts when they're not Islamic themselves, or Muslim themselves. So it's perhaps a little bit related to your question as well. Is it appropriate for a Western medic to be talking about Islamic concepts and how that relates to health? Or is it better to relate it back to your own background, perhaps your own religion if you have one? Or is it acceptable in fact to be talking in those kind of terms?
So what I think is, yes, every human being, irrespective of which religion you belong to, I think is very appropriate, and it's must to me, to ask questions about your religion, about yourself, and about any other religion. That's why you will find the facts, right? That's why I have first problem, as I said, with my own Afghans, that I ask them, why you're a Muslim? They don't give me the right answer. So I first try to get this question to them to understand why you're a Muslim, so that any international staff who comes, it should not be me talking about Islam to you or to Christianity. I would very frankly say, yes, okay, this is what I believe and why I believe. Because it is everything is, I'm getting, benefit, benefit, benefit. You're practicing this religion, how much benefit do you get? And then we need to also logically, socially, scientifically, analyze, so that we exchange knowledge and experience, and that's why I say everything is hell. The ignorance is the biggest problem of humanity around the world. So yes, but with a very right question and answers, and a very appropriate way of putting questions, like what he put. Yes, I say that is what the human being around the world is in loss, because they do not have the time to communicate and inform them very well what the fact is. So yes, I say it's very appropriate, but in an appropriate way, in a taken situation, the way you are, right? So yes, that's why this is the first time in Afghanistan that I say ask any question, no problem. But when I didn't know Islam, I would never allow you to ask me questions. Thank you.
I'm a midwife, so I have maybe a more practical question.
Yes, please.
You were talking about alcohol and the bad influence it has on people, also that even if you have an alcoholic father or somebody in the family, that it can affect the children, and if they grow up that they can have negative consequences. Now, I would like to bring it a little bit back to the question of Dr. Wali and family planning, which you say family planning is considered okay, because even in the Quran, it's considered that you can do spacing of children, that you have to take into account the financial means that you have. But what happens if you come to this point that, for example, you're taking family planning, but the method fails? Because we all know that every method has its own, the pill, it's 90%
the side effect it has.
Yeah,
yes.
You also have, even with an IUD, you can get pregnant. So then the question is, what would Islam do about this? Because sometimes a child can be born and can be unwelcome because there are no finances, because there are no, the family doesn't have means to raise another kid. So I'm just wondering, what does Islam say about this question?
Great, very good question. Now, what the Islamic strategy is to have cost-effective approaches. You should not spend money, but you should get better health. Now, I tell you, the best thing that Islam would recommend is three things. One is that we have to educate both couples, men and women, what is safe period. It needs a good education to understand what is safe period. And then combine safe period with coitus interruptus or withdrawal. If you do that, it might give you much more results. If you really understand the safe period, that's the key question to it. And if you have a control system on yourself, to combine these two, you can have a great family planning. I would be I question the doctors that why would you use pill to do the family planning? If you really understand the safe period and if you can combine it with coitus interruptus. But not everybody has that control. Then you go to the pill, yes, condom, whatever. You have to weigh the loss and gain part of it. How much you gain by using this pill. If the gain is extra, do it. If the loss is more, don't do it. That is very, very practical. As I said, haram and halal changes in Islam based on the benefit, as I gave the morphine example. So here also, The first Islamic strategy is without doing or taking any pill, because again I say, just for the sake of all health professionals, every drug we prescribe is haram in Islam. Every drug is haram, haram, haram. So see, every time we are writing all haram, the patient doesn't need, we don't have any diagnosis, writing a lot of haram things. So we doctors, that 100% every day we are doing so many, haram means harmful thing to us and to patients. I don't think anybody will be able to give the accountability, if not here, there. Now, the drug will be only halal if you really diagnose the patient right and see the drug benefit goes beyond the loss of the thing. So in family planning also, the option is that according to your situation, according to your ability, according to your control system that you have on yourself, then you need to decide. But to me, the best thing is that if someone who is educated, who understands Islam, he will do without pill. He will be very successful family planner. Thank you.
I'm sorry, but just to come to reality, I know what you say is right. If people are educated, you have a lot to win. But the question is, I'm working in Helmand, and I think my colleagues can agree with me that we have a lot of uneducated people, and we will not educate them in one day. It will be a very
So it takes time, yes.
So the question is, what do you do in
Yeah.
meantime?
So in that time, you have to look at the situation analysis, because this education takes time. So everything that you educate people, it is time consuming. At this situation, then you have to decide that, okay, the pill benefit is more than that having 10 children. Then you talk to them, make them education, and you can use pill or whatever the contraceptive may be. So again, the Islamic law is, the situation in Helmand is different than in Europe. It's different than India, right? Look at in India. Every day, 3,000 fetus are aborted because they are girls. Still, is the world a safe place? That's what I'm saying. So situation analysis from time to time, from place to place changes, and the general rule is whatever is giving you the more benefit, that's what Islam recommends. Thank you.
Thank you very much for your presentations. It was a bit touchy to the Muslims. And there is, of course, Islam is teaching everything to us. We cannot refuse any of the words he said. But there is a difference between the health and the services to be provided. I mean, to the saving lives. But here in Afghanistan, we don't have so much greater ideas of Islam to everybody and to our people. But we have a great problem to the education. But we can how to save life in Afghanistan. Sorry for my voice.
Yes.
But how to save life is an immediate action to be done quickly, rather to teach for a longer time. I would like you to suggest us in this kind of situation, what can that...
Okay. The immediate
money.
answer of Quran to save life is, Quran says, if you save one life, you have saved humanity. Right? So that is the short strategy. If the saving life is not needed, you do it. That's what you improve health. Islam says if you save one life, you have saved the humanity. If you kill one life, you have killed the humanity. So that is the strategy. If now situation requires emergency intervention, do emergency. But in any time, do emergency, have a short and long-term plan.
My question
maybe I didn't answer.
it has to be a Muslim to be fully aware of Islam, or to have the knowledge of the health. To do health and save life.
Good question.
What's the difference?
My thinking is you cannot save life. You cannot even save your life if you do not understand Islam, your Quran as a Muslim. Thank you.
Two questions. One would be sort of looking at Afghanistan and knowing that this country has one of the worst health indicators in the world, specifically in the region, and being an Islamic sort of country, how could you maybe say a few more specific, really specific things apart from hand washing and not smoking? Of course, I agree as a doctor, but of course that doesn't save or will not increase the maternal mortality rates in the country. So what could you say from your subject for this country, more specific, what could be done? Second question is MSF. Of course, we are an organization, a medical organization, and we say again and again that we are sort of a non-religious organization. We believe that by doing so, we do not exclude anyone. Yeah? Because if we say we are Christian, we exclude the Muslims, or they will feel excluded. If we say we are Jewish, we exclude others. Yeah? That's why we believe being a strong medical profession, and I think that is a little bit different to what you say, is maybe even better to serve the populations in need than being sort of first religious and then a doctor. Yeah? So in that understanding, I wonder, and I would like to ask you, can MSF play a role here in Afghanistan?
Thank you. Very good questions. First of all, specifically, as I said, the core problem of Afghanistan is, for the centuries, if we have not understood Islam, because Islam is the ultimate solution to health, as I say, in Islam, it is must that every girl and boy has to be educated. So I'm asking my people that how come we Muslims in this country, we have such high rate of illiteracy? It does not correlate with Islam. In Islamic country, there should not be one single human being without education. And education is the main core for understanding health. And you, as more on a doctor, the people, if they understand health, they can prevent and promote their health more than the doctors. Because the Chinese says, the greatest doctor is the one who do not allow people to fall sick, rather than make them sick and then you treat them. For example, if let's say Europe or America is really concerned about health of Afghanistan or any other place, you will never allow your country to import alcohol. You will never import this cigarette. This is to what the world says is a double standard. So now I say, as I said, Islam teaches you to help every human being. It doesn't say to help only Muslim. As I said, Islam in Quran says, if you save one life, it doesn't say life of Muslim or non-Muslim. You have saved the humanity. So the teaching is that every Muslim around the world should go to Europe, to America, to Africa, even to save lives. Because if I save life here or there, God is going to give me happiness here and there. So to me, because of understanding of Islam, the first time in the history of Afghanistan, Ibn Sina is now out of Afghanistan, like we have crossed the borders. We have work in Pakistan. We are improving health, a lot of emergency program we have in Pakistan. We are now gone to Central Asia to teach, the management and all that. And now we are approaching India, and we will hopefully be in Africa. That's what Islam taught me, to go beyond borders for all humanity. That is what I understood it from Islam, not from any other thing. Now, for MSF to do better job, it's very important, whether it's MSF or any international organization or country, to understand the real concept of that, whatever religion is. You will work much more easily and effective and efficient rather not knowing it. You see, that's what I'm answer. So I've got this teaching to help other people, because today I think Europe needs a lot of help. I mean, because the indicators, I tell you, in Millennium Development Goal Conference in Cape Town, I raise a question. Even the indicator which has been set is not the right indicators around the world. WHO needs to change. I had a big discussion on how indicators, I told you, the indicators should include many other things about showing your real health. As I said, 80 million unwanted pregnancy, this is the right thing? As I gave the Japan example, that okay, with war here 6,000 people are killed, but without war, in many countries, people commit suicide. Why would they commit suicide? Japan needs to...
But please again to Afghanistan, yeah, that's what we are here for. Could you, and of course everyone agrees education is extremely important, and every study shows the more education, the better is the health. But of course education takes decades, takes generation to improve. But of course the health cannot wait in Afghanistan. So again, please, can you indicate from your point of view what can be done better in Afghanistan to improve the health situation?
Yes, thank you. Specifically for MSF, as I said, in emergency, there are teachings. There are many emergency cases that without, like if a Muslim is taught that if you save one life, even first aid, which can save a lot of life, that if he's taught even first aid, and he understands that this is Islam telling you to save life so that you're saving humanity and you get everything, while we are saving life, right, the people, Afghan people who are working with you, they should also have the understanding of their own religion to talk to people that this is what Islam tells me to save life, right? The acceptance goes more and the education continues. That's what I would say, that you will be more efficient and more effective.
Services of Afghanistan. You've now talked about health and about sort of the importance of health for everyone. But do you see that, say, a Department of Islam and the Ministry of Economic Affairs, Islam and Rural Development, should every ministry have a department like that? And does religion, say, improve all the services that the country needs?
Very good question, yes. I went to Dr. Ahadi, if you know, he was ex-Minister of Finance. Because I know all of the people around in the government. Most of them have come from NGO community, and I was the chairman of Akbar during Taliban. So I said, I have a purpose to meet you. He said, what is the purpose? I said, you're working for health. He said, oh, I'm working for health. I'm the Minister of Finance. I said, that is what I want to educate you. And we went through a debate with Mr. Ahadi. After the end of the discussion, he said, oh, it makes sense. I went to Asif Rahimi. I said, why you're the Minister of, what is the purpose of agriculture? What do? You do more production of food? What food is needed for? Yes, I say every minister has to have the concept clear, and in every minister they needs to have this system in place. As I said, I go to the ministry of whatever ministry, that first I ask, do you have a place to relax, to have washing my hands properly, and do my pray in the afternoon, and do you have place for women? If you don't, then I don't think you're improving health. So yes, that's what I believe every ministry is, to improve health, and they have to understand why he's doing this. So Minister of Agriculture, he's directly working for health. Minister of Finance is directly working for health. To me, President Karzai is directly for health, but that's what they don't understand. So according to me, I need to educate them that yes, they need. That's why the Ministry of Education now have been convinced, and they have a deputy minister now in their ministry. And I'm sure, as far as I'm concerned, I want to make Afghanistan a model, real understanding health and also Islam, to be a model for the whole world. And we should not be always in the receiving ends. We even should give a lot of knowledge to the, the international community. While they go to their country, they can improve their health further. Thank you.
Sorry, this a question could be a bit tough one for some of the people. Actually, the Quran, the second chapter of Quran, Surah Baqarah, says killing a life is the greatest sin. But where Quran time and again says saving a life is saving humanity. Now, being here, as you said, you want Afghanistan to be a model for most of the Islamic countries.
In the world.
In the world, sorry.
Yes.
The thing is that if there is a forced rape and the girl gets pregnant, what do you think the concept of abortion there in Islam, especially here in the view of Afghanistan, where religion is more dominating rather than other things?
Right, very good.
Saving the person who's inside mother's.
Right. Okay, very good.
Saving the person, she's suffering. Which one is
very good
more
question.
precious?
Very good question. First of all, if the Islamic laws are really governing, very little case of rape will happen. First, the rate of happening of rape will come down. Now, in the United States, every day, how many rapes happen? Every day, I mean, I may not be right in the statistics, but some people say 2,700 people, girls are raped every day. Now let's see how many people are raped in Afghanistan, even if you don't know Islam much. So the first thing, when the Islamic law is applied, people will not dare do such a, crime. One. Now, when it happens, human being, you cannot eradicate evil action. You can reduce it. One thing we have to understand, that as long as human being exists, evil cannot be eradicated, but can come down as much as you can bring it. So even in an Islamic country, a rape happens. Now, first of all, the one who has done this action should be executed, so that other people should understand. They will get the capital punishment. The girl has no fault. So in these cases, there is everything possibility, abortion, whatever. Now even a mother who has medical problem and gets pregnant, here Islam allows, if the life of the mother is in danger, you can go and do abortion for the child. So there is very clear in that, because Islam's strategy is to save life, saves life. Now, that's what I'm saying. So if there is Islamic law, the rapes, who can dare to do that? Very few people. And then they will get punishment, the right punishment. So yes, it's very 100%, supportive to give the right to the girl, not to anyone. Thank you. I think, no, you.
In the previous discussion, where you said that basically free healthcare does more harm than good. And then from your presentation, and taking into consideration the context, the high rates of poverty and the high rates of illiteracy, what do you see as the space for the provision of free healthcare in a context like Afghanistan?
Thank you very much. So a little bit elaboration. I do appreciate free for the people who really need it, they're in need. For example, we are in Ahmad Shah Baba. There are all kind of people there. People who have house which worth $2 lakh today, $200,000. She's also coming. She can all afford to give you some sort of a contribution. So for that also is free, and someone who does not, cannot afford, and your quality will be definitely very, very different. Now, because I have 20 years of experience of all, I'll give example of 1990. In 1990, when I was the director of IMC, we were for the first time we changed this and introduced the cost recovery system. Qarabagh is a hospital. Qarabagh is a district of Kabul, in the north of Kabul. During communist regime, we made that hospital. And we started, that hospital was seeing 6,000 patients per month. And we were thinking about how we introduce the cost recovery, what are the pros and cons of this. You see what happened in Karabakh, if people know that area, there are 2 days of, bazaar day, the market day, people come. So what people used to come for bazaar, marketing, they definitely, whether they're sick or not, they used to come to the hospital so that they wanted to take also the supply of medicine to take home. And obviously, when they are not sick, they have come to take supply of medicine, a lot of fighting and this and that is happening. So we started very small fee-for-service. From 6,000 patients, it came to 3,000 patients. So to me, MSF needs to evaluate that if your number of patients has gone to 10,000 is a good sign or is a bad sign. You understand what I'm saying? There has to be a differentiation. People who can afford, do not get them into the cheap behavior of free things. The free thing, getting free anything is a very negative thing in mind, which when you have negative thinking in mind, your biochemistry and physiology goes on the negative side. So I'm not saying not for everyone. The people who are, there has to be a system developed. Maybe it's a bit in the beginning expensive, but it's not. There has been this experience and this whole system has been implemented, but all of a sudden government changed it, which I say is a very big mistake that happened. So no, what I say for the people who are really cannot afford it, it should be free. It's a great noble cause. For people who cannot afford it, and if you do free, you do harm. That's what I'm saying.
I would like to ask you one question about Islam and health. What Islam is doing and what is health doing? Or my question is about cancer. What Islam did and said before about cancer, or what now scientists or the people who are discovering different kinds of diseases, and what are they saying? What is the main source of cancer? How it happens? How it comes? If you give a little bit of information about cancer.
First of all, you have to understand health, as I said, is everything means health is life. In Islam is the law and rules and regulation and policy to make this life beautiful. Okay? So this, I hope, with simple words. Now, what Islam has done for cancer has done a lot of things for cancer. Islam said don't smoke, don't drink alcohol, don't do adultery, HIV, AIDS also, whatever. So Islam is giving you everything. If you have a very scientific and practical style of life, who gets cancer? The risk factor of people who become obese. Now in Islam, is clearly the general rule, drink and eat, not in excess. Now, when I was doing a conference for religious leader, I said, anybody whose bellies are bulging, his Islamic faith is very weak. Because how can you eat so much that you harm yourself? Once you become obese, the cancer, any damn thing on the world is coming to you. You cannot sleep, you look ugly, you cannot climb stairs, you cannot sleep. Cancer is going to come to you, hypertension is coming to you, diabetes is coming to you. So Islam has done everything to prevent cancer. Thank you very much.
Now, if somebody does exactly what God is asking to do, he will be disease-free for the rest of his life? There will be no disease?
Wonderful question. Yes, but nobody on this earth can do 100% right things. You need to at least do something to pass, to get 50% mark. When you go to school, the passing score is not 100%, I think. It's 50%. So if you get 50%, you are in a good shape. If you get 60, it's great. Beyond 80, I believe nobody on this earth now can get to that. If you get 80%, So 20% definitely there has to, as a human being, you cannot. 80% is a great position to have. Even with 50% in Islam, means if you get 50 marks, you're better in this world, and then also you will get heaven forever. So with 50%, not with 100%. Thank you. Okay, well, I think you had a question, and maybe if the time allows, I have no problem. It's like, okay, you please.
I think it's a bit, my question would be a bit out of this forum, but as you're talking about Islamic studies, Islamic issues, let me know, I mean, this question is not solved yet to me that what Islam is the perfect Islam. I mean, we are talking about school of thoughts. Yeah? There are different school of thoughts in Islamic now, these we are seeing.
Yeah.
So, in one of them maybe suicide can be allowed, yeah? So, I just want your elaboration on that.
Thank you very much. Islam is one. Islam has the main sources Quran and the Prophet, peace be upon him. Okay? I do not believe, if you ask me, now you may ask me like this, am I a Sunni or a Shia? My answer will be, I don't know. What is Shia? What is Sunni? What is Wahhabi? I don't know. I know only Islam. And I'm only Muslim. And I only follow what Quran says and what Prophet, peace be upon him, has done. Right? So, that's very clear. That's why I'm answering all things from Quran. I'm not answering from my brain. This concept is not, the thought has come. As I said, I learned health from Islam. I never learned it from Harvard. I never learned it from, from India. I learned medicine from India. Medicine is a very small part of health, which health is the whole life. So, it's very clear, yes, many people, whether it's Christianity, Hinduism, Islam, they do a lot of wrong things in the name of that religion, which is always when human beings do any wrong thing, they get an excuse for themselves and they force it. So, but it's very clear. That's what I say. Now, another suggestion to the whole Muslim community of this world, to me, is, there should not be anybody saying that I'm a Sunni or Shia or Wahhabi. I say every Muslim has to say that I'm a Muslim. That's all. Thank you.
My name is Gulkhan from Helmand. As we all know that all religion has their own life protocol guidelines. But me as a Muslim, I agree with all what Quran tells us about health and about how to go through life. My question is, I live in a very backward and volatile province, Helmand, where the gap of education is very, extremely low. Even nobody know about the basic thing of Islam. So my question is that with all the organization, the Afghan national organization who come to Helmand, why didn't instruct people to know basically Islam, and what would be the solution? I have seen many people who are working there, like embassy now working there. They were providing medicine for the people. Why were they not why they were not instructing people? Why they were not telling people to do Islam, to go through Islam and follow up Islam about to be secure? To be well with that. Why there is no practical action, practical activities about that?
Thank you very much. Good question. First of all, before you go to any other person, I would very humbly request you that now you're working in Helmand to refer to Quran, understand Islam, and you start practicing the healthy style of life and make other people also educated. One. Second thing, you may not be aware, Ibn Sina established the whole system in Helmand. When we went, there was nothing. We claim that we established 52 health facilities for the last 5 years. Some may be very functional, maybe half functioning, but through the 5 years, it's a history The whole system has we put it there, right? Now I don't go with all this politics that why Ibn Sina is out of that. No problem. We are not, responsible for Helmand for the whole life to come. It's the Ministry of Health responsible. But you may not know that many Helmand people who are working with Ibn Sina, they came to our institute for training. And myself was always taking classes, even as family planning. I had a class with people who came from Baghran and wherever, and I educated about this. But this education and understanding is not a day or 2 days work. This kind of education and understanding life takes all your life to understand it. Thank you very much.